Hi viewers, today's program is going to be very interesting. I'm going to talk about squint. I'm Dr. Rajinikantha. I'm an eye specialist. I have a hospital 𝗃𝐸 center at T Nagar, Chennai. And this program is going to be very useful because many people come to us and say, they bring their small children and say, doctor, the child is not looking at me properly. One eye is always facing this side, or it is facing this side, or this eye is facing this side. Instead of being parallel like this, eye should move parallel. All our eyes, when we look, it should be parallel. If you look like this, it will go parallelly. When you look like this, it should go parallelly. Similarly, when you look up, it should go parallelly. When you look down, it should be parallel. But when one eye is delaying, this is moving faster, this is slow, then this is known as squint. Or if one eye is straight and the other eye is facing the ear, it is a divergent squint. When one eye is straight, the other eye is facing the nose, it is a convergent squint. Then if one eye is like this, the other eye is up or down, it's a vertical squint. So there are 6 muscles in the eye which move the muscles. 6 muscles are there. When they contract, the eye moves in that particular direction. So all of us have 6 muscles. And if one muscle is also a little weak or paralyzed, then there can be squint. So when a person comes to us and says, sometimes they see double vision. They'll come and say, since last 5-6 days, everything's looking double. When I look at this person, it is not a single image. Slight deviation is there. It's like a disturbed image, double vision. I'm not able to concentrate on anything, especially the computer. So I don't know what is wrong. Then we check, we find that one of the muscles have become weak for some reason or other. And so we tell them this is the problem, we can rectify it. If we can do with exercises, there is a machine known as, equipment known as synaptophore. If it's a small degree of squint, we can put the person on the synaptophore, make them do exercises, teach them exercises, which will make the weak muscles strong. But if it's a very large squint, like 30 degrees or 40 degrees or something, then there's no other this thing. First, we find out the cause, whether the nerves are paralyzed. There are 3 nerves which supply the eye, 3rd nerve, 4th nerve, and the 6th nerve. Even if one of them is paralyzed, one can go in for a squint. So first we check, these nerves come from the brain, cranial nerves we call them. So when a person comes with a squint, first we should check whether it's a paralytic squint or a concomitant squint. Concomitant squint is something where the nerves are fine, but it's due to some other reason there is a squint. Whereas the paralytic squint happens when the nerves which come from the brain are paralyzed due to some reason. It may be some neurological reason, it may be due to some brain problem. So it gets reflected into the eye, they come to the eye doctor only. We check up everything, then we say this is a paralytic squint. These nerves are all paralyzed. Then we refer them to a neurologist so that in collaboration with the neurological findings, we treat the person. Because the problem may be much bigger than what we realize. It could be a brain problem, it could be some growth in the brain, some space occupying lesion, some cyst in the brain. It can be anything. So it is not just eye. When it comes to paralytic squint, we check all the nerves, and then if there 2-3 nerves are paralyzed, then we in consultation with a neurologist, we take a neurologist's opinion. So all the doctors combine together, we discuss, and then we treat the patient as how we should. What will be the most beneficial treatment, we give it to the person. It's not a problem at all. But we should know when we should refer, what we should do. Sometimes we even ask, when there's a paralytic squint, we even ask for a MRI brain to find out if there's any problem in the brain which is causing the nerve paralysis. As I mentioned earlier, the eye has got 3 different types of nerves: 3rd cranial nerve, 4th cranial nerve, and 6th cranial nerve. And also one more nerve is there, which is the 5th cranial nerve, trigeminal nerve we call it, that gives sensation to the eye. Because of the trigeminal nerve, if we touch this place, we know we are touching. If we touch the eye, we know we are touching. This is because of the 5th nerve. But 5th nerve is a sensory nerve. It's not a neuronal. It is a neuronal nerve, but it's a sensory nerve. So sometimes, the 7th nerve gets paralyzed here. Facial paralysis, we call it facial palsy. When that happens also, the eye won't be able to close. This eye will close normally, but this eye will be little open because these muscles, the eye closing muscles are innervated by the seventh nerve. The seventh nerve is a facial nerve. When there's a facial paralysis, this nerve not only supplies the eye, supplies this portion, this portion, this portion. If there's a total seventh nerve paralysis also, the eye won't be able to close. It will remain little open like this. So we check everything. What is the cause for this paralysis? What could be the cause? Again, we take consultation with the neurologist and we find out why this seventh nerve paralysis is there. Is there any brain cause for that or some other issue, or it is just a simple facial paralysis? So we discuss, we put our inputs, they put their inputs, we discuss, and then whatever is the correct treatment, we advise that, and the person becomes normal. So nothing to worry, but if there is a squint, that is, instead of the eye being parallel, one eye is this way or one eye is this way or up and down, or there is double vision, please immediately go and have a checkup done by your eye specialist. And if it is necessary, the eye specialist will consult a neurologist also. Hope this program was a useful program. Thank you so much for that.